Thank you, Mrs. Martina, for the introduction. Thank you, Professor Saporito, President, OCAM President, for including me once again in this high-level event and this great grand conversation. I am honored to be in the telemedicine panel, and I chose for this event to talk about how in the MENA regions, Middle East and North Africa, have responded using digital health to the COVID-19 crisis. So let me first mention that since the last year, I think in 2020, the beginning of 2020, there is a new dynamism coming in terms of digital health and innovation in the regions, starting with the consultation and an expert consultation meeting that was held in Cairo in last February with the presence of Bernardo, the Director of Digital Health and Innovation at the WHO, and with the representative from many countries in the regions. The idea is how we can boost digital health, including telemedicine in the region, and not stay behind the dynamism going worldwide. So this was the first meeting ever that really make experts from the region together to think about how we can contribute in bringing digital health to the agenda of the respective countries. The same year, in the month of August, Saudi organized a global digital health summit. Here is the publication of the declaration that was published in the Lancet of November 2020. If you would like to get more details about this meeting, but it's in the stream of the same dynamism, and brings to the table 9 main recommendations. Let me mention a few of them, like improving digital health, the need of improving digital health infrastructures, reaching the digital maturity, or providing the necessary technology to accompany this digital health transformation. And of course, the need of training a new generation of physicians and technologists that will implement and adopt the digital health technologies in their daily practice. So these recommendations actually are all published in the same article in the Lancet, if you would like to get more information. Now, in generally speaking, we noted 5 main digital health care application area that have been impacted by the COVID-19 crisis, namely remote monitoring, virtual care and telemedicine, diagnostic and triage, personal health management and wellness, data analytic. I took this from this source, but it really reflects what has been doing in Morocco and other countries in the regions. So we published recently a paper in the yearly book of the International Medical Informatics Association that featured the following countries: Algeria, Jordan, Qatar, Oman, Palestine, Iran, United Arab Emirates, Saudi Arabia, and Morocco. All these countries have actually experienced some kind of digital health response to the COVID-19 crisis for the first time ever. So this is the publications that I would like you to consult if you would like to get more information. It's published by the MENA, which is the Middle East and North Africa Health Informatics Associations. Uh, I will just mention few examples here because of the lack of time. So, for example, in Bahrain, there was a central system named iSiha that used to report all COVID-19 results and also use it to manage travel testing requirements and vaccine status tracking. There was also a mobile app for tracing COVID positive individuals. Of course, this application was also used for booking testing appointment and viewing COVID-19 tests. COVID-19 test results. This is few of the examples that have been going in Bahrain. Egypt also have also included digital health in their health management of the crisis, and patients were actually triaged into three categories: emergency care, outpatient care, and telemedicine care, both synchronous and asynchronous. So in asynchronous telemedicine was performed through WhatsApp or Facebook. In synchronous telemedicine, there was actually video consultation using Zoom, and later on using a homemade platform named AVH platform. Also, there is a mobile application that have been created and used for triage of COVID-19 and non-COVID patients. In Jordan, there was a community-driven applications named Aman. Aman means safety in Arabic, that have been using GPS to detect exposure to COVID-19 patients. There was also electronic medical platforms named Electronic Service Platform EMED, which enable patients registered in the electronic health applications Hakim, which has been made before in Jordan, to request their monthly recurring medications electronically, and aiming to save time and effort during the COVID-19 confinement. The King Abdullah University Hospital, one of the main hospitals in Jordan, have launched a free smart application that allows their patients to book appointments, make reservations, and access their medical record. Qatar made an application named Ihtiraz. Ihtiraz in Arabic means caution, and for contact tracing applications, and was made mandatory for each resident. Other applications were like Wiqaya, means preventions, and Isra means emotion sensing recognition app. The second one was to manage mental health symptoms for during the confinement. In Saudi Arabia, there was, I think, one of the main advanced country in the region in terms of digital health applications. So there was digital tools, platforms, and applications that have been created and used for COVID-19 screening, surveillance, contact tracing, follow-up, and raising awareness. There was also application for COVID-19 symptom checkers for patients, and of course there was a health electronic surveillance network that was leveraged as a reliable database to include all COVID-19 laboratory tests that have been going through the COVID-19 patient during the COVID-19 health crisis. Let me spotlight my country, Morocco, which has been experiencing for the first time, I think, in intensive implementation of digital health in health system as a whole, but including impacted, accelerated by the COVID-19 crisis. And this is a list of all area that have been impacted by the digital health. So there was LIS, which is laboratory information system management to test for test and diagnostic operations for COVID-19. There was a creation of the consortium for virus transmission monitoring and genomic surveillance. Protocol integrating telemedicine into patient care for the first time. The setup of many platforms for remote care, mainly
sound connection, please. Sound connection problems.
Yes, it seems that
Hassan, connection.
Dr. Ghazal is experiencing some connection problem.
Hassan? Yeah.
It's a normal be connected with Africa, with any country, and that is the state of art of the
Info poverty.
internet. So we keep 1 minute, but after we can pass to the next. Maybe Hassan will join us later. Hassan, can you hear us? You can continue. You have a break. You have a break. Go on.
Hassan.
Audio, Hassan.
Okay. So I forgot to turn on my microphone. So I was saying this is a list of so this is a list of areas that have been impacted by digital health during the management of the COVID-19 crisis. So I was citing the using laboratory information system to manage test and diagnostic operation for COVID-19, the setting up of a consortium for genomic surveillance, integrating telemedicine into patient care, many platforms that have been created for remote care of chronic patients, updates of the law of telemedicine to upgrade and to meet the needs during the COVID-19 crisis, contact tracing and follow-up applications, and also using information systems, laboratory for data collections and analysis, and finally using information health, digital health for a smart vaccination management strategy. This is actually the scope of a paper that that will be published soon in the Frontier in Public Health and in the section Digital Public Health. So if you need more information, maybe next month or 2 months, the paper will be online. So to summarize here what was in this paper, for example, for the genomic surveillance, we have actually we have been using bioinformatics tools to trace the source of the first introductions of COVID-19 in Morocco, and actually 4 countries were actually accused, not accused. I mean, I'm kidding, but were not suspected, were proven to be the source of the first cases in Morocco, namely Italy, France, Portugal, and Spain. Most of them actually France and Italy, because of the human connections we have with these 2 countries. So, and this is the protocol that have been set for COVID-19 patient care that was actually recommended by the Moroccan Society for Emergency. And this is for the first time that such protocol, care protocol, will mention telemedicine upstream, the protocol for the suspected cases, so in order to protect the healthcare providers, but also at the upstream, at the downstream of the protocols for follow up for asymptomatic patients at home. Then, as for the legal aspect of telemedicine, there is actually a decree that have been published in 2018 for telemedicine. But we had an issue with this law. It said if you want to do a teleconsultation, a health provider should be at the bedside of the patient, which was impossible during the COVID-19 crisis, and the government has to change this has to amend this law in emergency in order to allow many platforms that were created during the crisis and to continue providing care for actually for cares. The thing is that for the first time, the National Council of the National Council of the Order of Physicians, GNOM, has set up a telemedicine commission. Let's mention that before that, the order was not really caring about telemedicine. And I am proud to be part of this commission. And the idea is how we can facilitate the implementation of practice of telemedicine by labor and public medical doctors. The work has been has already been fruitful because this work has accelerated the amendment of the law and making it more easy to practice telemedicine in Morocco. So there was also an application named Corona Wiqayatna, which means my protection, our protection for coronavirus exposure notification and application for tracing and tracking of the virus. The order of the Ministry of Health also set up a teleconsultation platform free of charge, but it's not the unique one. Dozens of other platforms have been created like fungus during the first month of the crisis. Most of them are not really working right now. To let you know that we have still a lot of work to do to convince medical doctors to adopt telemedicine. And finally, there was what you call smart vaccination campaign that included digital health for all aspects of the campaign, including registry, stock management, logistic management, and side effect tracking. So there is actually a website named Liqah Corona, which means in Arabic corona vaccines, that actually allow people to make appointments, but also to download their certificate digitally. All these things have never been thought to be done in such speed way if the COVID-19 is not here. So we are very proud at Telemedicine Moroccan associations that for the first time things we are optimistic about the future of digital health in Morocco, but also in Africa and the rest of the regions. Thank you very much for your attention.